Good evening. Today we will be learning about the highly tested topic on nclex examination, respiratory system and ABG interpretations. By end of this session, you will be able to understand the anatomy and physiology of the respiratory system, then differentiate between the oxygenation and ventilation, identifying the normal ABG values and how we can interpret the ABG results using a step-by-step approach. Finally, we can recognize the respiratory and metabolic acid-base imbalance. Accordingly, we can prioritize the nursing interventions without any doubts by using the clinical judgment. Before discussing the thing, we must know about the anatomy of the respiratory system. So, our respiratory system consists of upper and lower respiratory tract. So, upper respiratory tract, it starts with the nose, pharynx, and larynx. So nose, usually the air will enter into that passage. It has filters like ciliary hair-like structures. So it will filter the air when it enter into the nose. Then it will pass into the pharynx here. So pharynx, it can be the passage for food as well as the air. Then it will reach into the larynx. Larynx is a voice box. So it will facilitate the speech. Then the lower respiratory tract starts from the trachea. So trachea, it's you just imagine as the tree like upside down. So trachea is the trunk. So the branches are bronchi. So the smaller branches are bronchioles. In that bronchioles, you consist of tiny sac-like structures called alveoli. Here is the major part where the gas exchange takes place. I hope now you understand the anatomy. Let's talk about how the work of breath actually takes place in our body. So when we inhale the air, so it will enter into the uh, respiratory tract through trachea, from nose to trachea. So then it will enter into the bronchi. So through bronchi, it will reach us to the bronchioles. In this bronchioles, as I mentioned, that it consists of tiny sac-like structures called alveoli. Here, alveoli, you can see the inhaled air will enter, diffuse into the bloodstream. So once the diffusing takes place, at the same time, the carbon dioxide also will leaves from the bloodstream. So this is what the gas exchange will take place during inspiration as well as the expiration. I hope you understand the physiology of respiratory system. Let us discuss about the core function of respiratory system. So we must know about the functions the respiratory system plays major role in our body. So the first function is gas exchange. So previously we discussed about how the gas exchange takes place during inspiration and expiration, how the air entering into our body, so how the carbon dioxide will go into the bloodstream and they eliminate the waste from during the cellular metabolism. Then second thing is acid-base balance. So it is helpful for the regulation of blood pH. Then only we can maintain the normal pH of blood in our body. If any variations takes place, it will end up with some imbalances in the respiratory system as well as in the renal system. The third one is it is protecting them. It acts as the protections, warming and humidifying and filtrations. Like the air enter into the nasal, we have a hair-like structures. Here the filters takes place. Then vocalization and speech. So respiratory system, mainly the larynx will helpful for facilitating the speech when the airflow overs the vocal cord. The fifth one is thermoregulations. So minor heat consumption takes place. It helpful for the thermoregulation in our body. Then olfaction concept. It's like it will helpful for the sense of smell. So these are the core function of the respiratory system. So the NCLEX clinical correlation tip. So whenever you are evaluating the patient respiratory system, always remember the differentiation between the oxygenation and ventilation. Do you think oxygenation and ventilation are the same? No. So it's not the same. So oxygenation is the oxygen in the blood. Ventilation means it's a clearance of CO2 when the patient have a normal SpO2, but still in severe respiratory distress or failure if they are failing to ventilate properly. It can lead to hypercapnia and respiratory acidosis. So always remember, oxygen and ventilation is not same when you getting the questions related to normal SpO2, but the patient's CO partial pressure of carbon dioxide is elevated means the patient is retaining the carbon dioxide. So let's review the ABG components first. So we must, before interpreting the ABG results, we must know about the normal values. So the parameters mainly pH, then partial partial pressure in carbon dioxide, then partial pressure of O2, then bicarbonate. So the pH normal value, the ranges from 7.35 to 7.45. So overall, the clinical significance is overall acid-base balance. So if it is less than 7.35 means it indicates acidosis. If it is more than 7.5 means it indicates alkalosis. So partial pressure of carbon dioxide, the ranges from 35 to 45 mmHg. So respiratory indicator, it can be controlled by the lungs. So it act as an acid in our body. Then bicarbonate, the ranges from 22 to 26 milliequivalent per liter. So it is an indicator of the metabolic. It's controlled by the kidney. So it act as a base. For NCLEX tips, don't forget to look at the partial pressure of oxygen, 80 to 100 mg, that is normal. So on the SpO2 is less than 95, they are low. The patient has hypoxemia, which may be the driving factors behind the respiratory system. So before interpreting the ABG results, you have to ask 3 questions to yourself. First one is this alkalosis or acidosis? Is it a respiratory or metabolic problem, or it is uncompensated and partially compensated or fully compensated? We'll see one by one. So first we must know about the normal values. If you know the normal values only, you can easily interpret the ABG results. It is essential to memorize the normal values. Sometimes they will be given the normal values. It is better you should have a memory of the normal values. The first step, we have to check the pH. So pH act as a primary here. So pH is below 7.35 means it indicates acidosis. If it is more than 7.45 means it indicates alkalosis. So second thing, we must use the Rome mnemonic methods. So we need to find out whether it is respiratory or metabolic imbalances. So you can easily remember as mnemonic Rome. So Rome means respiratory opposite and metabolic equal. So the pH changes in the opposite direction of partial pressure of carbon dioxide changes. For example, you can see here, so the pH is less and the partial carbon dioxide is increased. So it indicates respiratory acidosis because the pH is less. So it is a acidosis. So respiratory opposite. So it's a respiratory acidosis. Then pH is increasing. Then PaCO2 is decreasing. So pH increasing means it indicates the alkalosis. So it is pH and the PaCO2 is in opposite direction means it's a respiratory. So it is a respiratory alkalosis. Here, metabolic equal means the pH changes in the same direction as bicarbonate changes. Here you can see the differences. So pH is reducing and the same direction the bicarbonate is also reducing. So metabolic equal. So it's a pH reducing means it indicate the acidosis. So metabolic acidosis the result will be. Likewise, the pH is increasing the same direction, the bicarbonate also increasing. So it indicates alkalosis. So it is a metabolic alkalosis. First, decide if the problem is metabolic or respiratory. So you can use the mnemonic respiratory opposite, and metabolic equal. I hope you understand this. So the third step, we have to assess for the compensation. So we have to look into the compensation method, whether it is fully compensated or partially compensated or uncompensated. Let's see one by one. So for easily you can remember this example, the broken home. So uncompensated state means it's mainly the acidosis. For example, you can see here the lazy partners like lungs and the kidneys. So the lazy partner, lungs, he says, oops, I retained too much of CO2 acid. So the lazy partner kidney also, I am not excreting any acid or making any bicarbonate base. Okay, so the both are tired, so they are not ready to compensate. So compensation means we have to find the common ground to make the pH within the normal range. Here they are not ready to balance the pH. Actually, they are tired. So uncompensated mean the pH is outside the normal range. So the critical Q, sorry, pH is outside the normal range, but the regulatory system is completely inactive. So it means it's a completely uncompensated state. Is it clear? Okay. Next, see about the partially compensated state. So partially compensated means, for example, you can easily remember as couple counseling. The two couples are coming for the counseling. The couples are lungs and the kidney. So as I mentioned earlier, compensation means we need to find the common ground in order to make the pH in the normal range. Here, the lungs retain too much of CO2, that is acid, but show the kidney, so pH is not, but the kidney is try to make the extra base. Likewise, when the couples going for the counseling during the divorce stage, so the one of them they are not ready to give up. They are not ready to adjust the thing. But one person they are ready to adjust to back to their normal stage. Likewise, only here, the kidney is try to compensate the things in order to make the pH within the normal range. So partially compensated means pH is outside normal range. The key Q is pH is outside the normal range, but regulatory system like the kidney is actively fighting, but not fully succeeded. They are trying to compensate, but actually it will not be compensated. Still the pH is outside the normal range. That is called the partially compensated state. Then fully compensated is a compensation. So it's finding like a common ground. So for example, both partners like lungs and kidneys are doing their part to balance the body and keep the internal environment healthy. So they are try to keep the pH within the normal range. So here the pH is back with the normal range. So the previous conflict is managed by conceptually orbits. So they are happy and healthy. So they are trying to make the pH within the normal range. I hope it's clear to you. So now we are in the next phase, how we can identify the clinical causes and intervention for the respiratory and metabolic acid imbalances. That is very essential for the high-yield NCLEX case study sometimes. Sometimes you may receive the questions. So first we discuss about the respiratory imbalances. Respiratory acidosis. So acidosis means, as I mentioned, that the pH is less than the normal value, 7.35. But the PaCO2 is increase because respiratory opposite. So the underlying problems are hypoventilations. The lungs is retaining too much of CO2. So CO2 is act as a acid. So the common causes are chronic respiratory conditions like COPD, then severe asthma cases. You can see them respiratory acidosis. The central nervous system depression as well. So opioid overdose, sometimes sedation overdose also will cause respiratory acidosis. Respiratory muscle failures, such scenarios like Guillain-Barré syndrome, then laterosclerosis or severe lung injury, ARDS, we can see the respiratory acidosis. So when it comes to nclex, the priority intervention is we have to maintain the airway patency. So we need to administer the oxygen, then we have to encourage the patient to take deep breathing, then administer the reversal agent in case of any opioid overdose or sedation overdose. Then we have to prepare for the non-invasive ventilations in case of COPD. So COPD means first we have to consider the non-invasive ventilation BiPAP or mechanical intubation in case of severe respiratory failures or ARDS. Does it clear? Okay. Next, respiratory alkalosis. So respiratory alkalosis means pH is more than 7.45, but the PaCO2 is less than 35. So the underlying problems due to the hyperventilations. Here, the lung is blowing off too much CO2, the acid. So because it's mainly due to the acute anxiety or sometimes panic attacks or severe pain or high fever, we can see the respiratory alkalosis. So early stage of pulmonary embolism also we can see the respiratory alkalosis. When it comes to the NCLEX priority, first we have to address the underlying causes. So what are the causes for the particular things? For example, we can manage the pain or lower the fever and calm the patient in case of the patient is restless or panic. So we have to encourage a slow or controlled breathing pattern when it comes to acute anxiety or panic attack. So we have to inform the patient breathing into the paper bag or sometimes cupped hands to rebreathe CO2. So these are the interventions we need to think when it comes to respiratory alkalosis. I hope you understood. So next move on to the metabolic imbalances. So metabolic acidosis means the pH is less than 7.35. At the same time, the bicarbonate also less than 22. So as I mentioned that metabolic means it's a metabolic respiratory opposite and metabolic equal. So here the pH and bicarbonate levels are low. It's in the same direction. So the underlying problems are excess acid accumulations or severe loss of bicarbonate. The causes are mainly due to decay. Look for the cusmal respirations when trying to blow up more carbon dioxide for the compensation, as well as the severe renal kidney failures to excrete the hydrogen ion or regenerate the phase. It will leads to metabolic acidosis. Sometimes you can see the metabolic acidosis from the severe diarrhea, losing base from the base, because the metabolic means it's a base. So we have to treat the root cause. So we have to administer the IV insulin in case of DKA and the fluid replacement. Then we have to prepare for the patients for dialysis in case of renal failure. Then monitoring the potassium level closely in case of hyperkalemia commonly occurs with acidosis. Then administer the sodium bicarbonate intravenously if ordered for severe cases. First, we must analyze the cause for the metabolic imbalances. If it is related to DKA, means we have to look for the DKA management like insulin administration. So when it comes to kidney failure, means we have to prepare for the patient for the renal dialysis. Clear? Okay. So next one is metabolic alkalosis. Metabolic alkalosis means the pH is more than the normal ranges like 7.45. The bicarbonate is again it's increasing more than 26. So metabolic equal. So both pH and the bicarbonate is increasing in the same directions. So the causes underlying problem here is severe loss of body acid or sometimes excessive accumulation of the bicarbonate base in our body. The common factors leading for metabolic alkalosis are prolonged vomiting or nasogastric tube suctioning. So by the time the losing stomach acid, it will cause metabolic alkalosis. Then excessive use of loop diuretic also lead to acid excretion. So it will end up with metabolic alkalosis. Then over digestion, over ingestion of antacids. So sodium bicarbonate also will lead metabolic alkalosis. For NCLEX priority interventions, first we have to discontinue or adjust the NG suctioning in case of NG tube suctioning. So the patient losing too much acid from the stomach. So we have to administer the fluid replacement and look for the potassium values very closely in case of hypokalemia. So it commonly occurs with alkalosis. Then we have to treat the patients with antiemetic in case of vomiting. So based on the symptoms, we have to prioritize our nursing intervention. So now we are at the end of the sessions. So far we discussed about anatomy and physiology of respiratory system, then components of ABG. So how we can interpret the ABG results step by step, like first we have to check the pH, then we have to look for whether it is respiratory or metabolic related issues, then whether the system is fully compensated, partially compensated or uncompensated. The three things will help us to analyze the ABG result wisely. So we have to always keep in your mind in the three things during our ABG interpretations. Then we discussed about the imbalances in the respiratory system as well as in the metabolic system. So what are the causes for the respiratory imbalances as well as metabolic imbalances? So how we can intervene the particular causes based on the patient symptoms. Now we are at the end of the sessions. So I would like to conclude, before concluding the sessions, I will give you one scenario, like the values for the ABG results, then how you can interpret the ABG results, then how can you use your clinical judgment model to prioritize the nursing interventions. For example, an 18 years old female patient is admitted to the emergency department after a severe panic attack. She reports feeling dizzy and experiencing tingling in her fingertips. Her vital signs are heart rate 112 beats per minute, respiratory rate 28 breaths per minute, and SpO2 99% on room air. An arterial blood gas is drawn and it reveals the results such as, excuse me, pH is 7.51, then PaCO2 is 28 mmHg, then bicarbonate is 24 milliequivalent per liter. So how do you interpret this ABG? So based on the next generation clinical judgment model, so what is the nurse's immediate priority action? So you have a time to work on it. So I will give you 5 minutes time. So let's work on this values. So interpret the results. So then you can tell me the priority based on the clinical judgment. All right. Okay. Our time up. Let us discuss the answer. So the first answer is uncompensated respiratory alkalosis. Is it? Why it is uncompensated respiratory alkalosis? Because the pH is high. So pH high means it's indicate the alkalosis. So PaCO2 is low. So respiratory opposite. Definitely it is a respiratory alkalosis. So we have to matching the alkalosis direction. Then the bicarbonate is completely normal. So meaning the kidney have not had the time to compensate it. So it is uncompensated because they are not ready to compensate the things because they both are lazy. So the answer, we have to assist the patient in slowing down the breathing rate by utilizing the coach breathing technique, or ask the patient to breathe into a paper bag to restore her PaCO2 level. So these are the interventions are prioritized in case of patient with uncompensated respiratory algolosis. Clear? I hope you understand the respiratory system, how it works, then ABG components, how we can easily interpret the results without any doubts during the examinations as well as during your clinical practice. Thank you.